Aquatic trial is a multi-center, randomized, double-blind trial comparing the addition of aspirin versus placebo in patients with a chronic coronary syndrome after stenting who required a long-term oral anticoagulation. It is important to define in this kind of patient who are at high atherothrombotic risk, defined by the fact that the PCI is performed during an acute coronary syndrome, or the fact that the PCI is performed in a patient with a diabetes, multivessel disease, complex PCI. In this kind of patient, it seems, if we analyze the last guidelines of chronic coronary syndrome, that we need to give an antiplatelet agent after 1 year when the patient, even if the patient has to oral anticoagulation. However, it's only a consensus. It's not based on data. So it's why we decide to perform aquatic with a placebo group. And the result of aquatic show us that the fact to add aspirin in this high atherothrombotic risk, we have the necessity to have a long-term oral anticoagulation, increase the efficacy outcome, which is a composite of cardiovascular death, of myocardial infarction, of stroke, of systemic embolism, any coronary revascularization, or acute limb ischemia. But also, this is attended, it's increase the risk of major bleeding according to the ESDH classification, but also increase significantly the risk of all-cause death. So now we know that in this kind of patient, even if they have at high atherothrombotic risk, they need to have only long-term oral anticoagulation, but not adding aspirin. I think this will change because when we perform the inclusion of aquatic, we see that at the inclusion, 67% of patients are still on oral anticoagulation plus antiplatelet agent. And the PCI was, in the majority of cases, performed more than 1 or 2 years. So it is the clinical practice actually, because this patient was at high risk, atherothrombotic risk. However, aquatic show us that in this particular population, it's dangerous to add aspirin to oral anticoagulation.